How does lung anatomy relate to lung cancer symptoms? Imagine your lungs as a complex network of tunnels and rooms, each with a specific role. When lung cancer develops, it can affect different parts of this intricate structure, leading to a variety of symptoms. The way the tumor grows and where it is located in the lungs directly influences what signs and symptoms a person might experience. The lungs are divided into sections called lobes, and within these lobes are the airways, which include the bronchi and smaller tubes called bronchioles. These airways are responsible for carrying air in and out. If a tumor forms in the larger airways or bronchi, it can block airflow, causing a persistent cough, wheezing, or even coughing up blood. This is because the tumor irritates or obstructs the airway, making breathing difficult. Another important part of lung anatomy is the pleura, the thin lining surrounding the lungs. If cancer invades the pleura or the chest wall, it often causes chest pain that worsens with deep breaths, coughing, or movement. This pain is a direct result of the tumor affecting the tissues that normally cushion and protect the lungs. Nerves near the lungs also play a role. For example, if the cancer affects the recurrent laryngeal nerve, it can cause hoarseness. If the phrenic nerve is involved, it may lead to diaphragm paralysis, making breathing even harder. Tumors at the top of the lung, known as the apex, can press on sympathetic nerves, causing Horner's syndrome. This syndrome includes drooping eyelid, constricted pupil, and decreased sweating on one side of the face. Lymph nodes in the chest and above the collarbone are part of the lymphatic system, which helps fight infection. When lung cancer spreads to these nodes, they can swell, indicating more advanced disease. Sometimes, tumors press on blood vessels like the superior vena cava, a major vein. This can cause superior vena cava syndrome, leading to swelling of the face, neck, and arms, along with difficulty breathing. When lung cancer spreads beyond the lungs, symptoms depend on the affected organs. For example, if the cancer spreads to the bones, it can cause pain. If it reaches the brain, neurological symptoms may appear. Liver metastases can cause jaundice, which is a yellowing of the skin and eyes. Most early lung cancers do not cause symptoms because they are small and do not invade nearby structures. As the tumor grows, it begins to affect these anatomical areas, leading to common signs like cough, chest pain, shortness of breath, hoarseness, and unexplained weight loss. Understanding how the anatomy of the lungs relates to these symptoms helps doctors identify where the cancer might be and how advanced it is. It also highlights the importance of early detection before the tumor causes significant damage or spreads. If you notice any persistent or unusual symptoms, it is essential to consult a healthcare professional for proper evaluation and diagnosis.